Hey everyone, Paul Wheeler here, Wheeler Health U. Today is Therapy Thursday, and we're going to kind of continue on from doing that ball rolling. So we just used the roller for the gastrocs and soleus, so we rolled out the calves due to some sort of discomfort in the Achilles. So what we do from there is you need a TheraBand. So if you grab your TheraBand, and you want to, we'll go to actually a kind of a little test. So let's say that when you're doing a calf raise, it hurts like right at the top, and it's like really specific to, like, let's say the outside. All right. So what you're going to do is you're going to just do, and it's very light friction. Start out very, very light, and we're just going to kind of multi-directional, kind of just do some circles, go up and down, go side to side, and kind of feel whether, where it's where there's discomfort, feel whether there's some, like, buildup of something, whether it's scar tissue, whether it just feels a little crackly, whether it feels bumpy. Ideally, the whole length here should feel smooth, so you kind of know, okay, there's something going on there. Okay, so just a little bit of, it just kind of gives your body some feedback there, and you're going to bring your foot, kind of the ball of the foot there, on the band, and this is kind of the first progression. So if you flex your foot, it stresses it, and you're going to slowly point and slowly flex. So you're getting that range, and you kind of do, let's just do like 10 repetitions of this. And so as you do this, assess, okay, how does the Achilles feel? Does it still hurt? Under this load, does the Achilles hurt? And if it doesn't, awesome, let's increase the load. So let's maybe pull it a little bit tighter. And then let's say, okay, now I'm starting to feel a little bit of tension right here, just a slight amount of pain there. So then what you do is you go back to it. Now let's go a little bit deeper. And again, this is not aggressive. We're just kind of bringing extra blood flow. We're encouraging the body to heal. And you circle, you go up and down, you go side to side, kind of just frictioning out that area that feels tender. And then you go back to it. I like to start out with the light resistance again, and you point and flex. So what I'm taught in the seminars, the orthopedic massage seminars I go to, is, doing the friction will help break up tissue, but it doesn't make it more of a functional tissue. It just kind of breaks it up, and then it just kind of sits there. So by doing the slow concentric and eccentric contractions, and they used to just say eccentric, but they've switched it to doing both, doing the concentric contraction and the eccentric, which makes sense. So it's really slow pointing and really slow flexing. You're just kind of putting some stress into that area, but it's creating more functional tissue. Okay? And then let's say that was fine. Then we'll make it a little bit more taut now. So now I'm like, okay, I'm gonna go to that next stress. This time it doesn't hurt. Awesome. So we're getting better and better. So then again, you just kind of keep progressing this, and you go to the next stress. I just doubled the band. So now we're pointing and flexing. And you can do this in a chair, but you're pointing and flexing in this position. Or if, sitting here like this is difficult, you can always prop your butt up in some way. But if you're sitting in a chair, you just do the same thing. Okay? So again, you're just stressing that Achilles with a greater tension. And let's say that was good still. So then you can start to progress to more of a standing position. So now we're going to lift up and slowly lower down. And what I can do is I can put a little less weight into it. I like to just start out with normal weight, so I just put the full amount of my weight into it, and if that feels okay, then we don't have to progress it. So you kind of go up and down. Again, you can do like 10 of these, And then the last thing you do is, if you're on a greater surface, or like a step or something where your heel can drop below neutral, you can stress the calf in this way. And I do recommend holding on, just so you don't accidentally like drive the heel down really hard, or step awkwardly and re-injure it. So, I know my head's starting to get cut off here, but so you're going to lift and lower, and you're just trying to stress now that calf in that greater range with a greater amount of weight. So it's a great way to kind of progress, and then you start to incorporate, if you were running or if you're walking, and just slowly progress and listen to your body and see, okay, is my Achilles bothering me? And then if it's starting to feel better, slowly progress more and more and more. And then do these exercises if you need them. Do the roll out your calves, and then do the friction if you need it, and then do the concentric and eccentric loading of the calf, and that's it. So I know that was a lot, but it kind of just breaks down exactly, as a massage therapist, how I would kind of treat the Achilles if I injured it myself, right? So let me know what you think. Let me know what you'd like to see in the future. Let me know if you have any questions, and listen to your body. Don't push through like that kind of pain, and you'll be good to go. Have a good day, and I'll see you next week.